I want to talk a little bit about reporting of information and data. When I became governor, one of my goals was to have more information available for decision makers, the legislature, executive branch, more information available to the public. I can tell you that as Attorney General, for 8 years going through and trying to look at data in regard to the drug epidemic, I was often frustrated by a lack of timely information that was coming to us. And so we have started down the path. We started down the path over a year ago to increase the amount of information. It's a path. We've accomplished some things, but we certainly have a ways to go. It is really imperative in this particular crisis that we balance the public's right to know and our obligation to protect Ohioans' health privacy rights. We have to balance both of those. So far, as part of our commitment to transparency, the Department of Health has developed several data dashboards to reflect data from multiple sources, including the Ohio Disease Reporting System, hospitals, local health departments. Much of this data is updated on a daily basis, and it's also available for downloading so that anyone, any Ohio citizen, can perform their own analysis of the data. This is the broadest and at the same time most granular level of information the department has ever made available before on infectious diseases, and it is updated on a daily basis. The data we currently share on the coronavirus is at coronavirus.ohio.gov. On that particular website that you're now all familiar with, it includes the following: an overview of the coronavirus cases, hospitalizations, and deaths by county and by the day symptoms first occurred. This data is updated daily. Next, we provide a breakdown of positive cases confirmed by laboratory testing and positive cases as defined by the CDC's new expanded definition of positive cases that relies on a clinical diagnosis. And again, we separate those out so you can tell what it would have been under the old counting system, what it is under the new counting system, and people can take that and do whatever they want with that information. The Department of Health breaks down cases by age and by gender. Again, many of these things you see every day with Dr. Acton. The daily cumulative case count and deaths are broken down by new daily cases and existing cases. The Ohio Department of Health displays current trends of cases, deaths, and hospitalizations, including reports received in the past 24 hours compared to the 5-day rolling average. Ohio Department of Health provides the age range and median age of cases, hospitalizations, and deaths. Ohio Department of Health also provides the cumulative number of intensive care unit admissions, updated on a daily basis, as well as the ICU admission percentage of total cases. Further, they have tracked the number of counties with at least one case, hospitalization, or death. The Department of Health tracks and provides the number of lab tests performed. The Ohio Department of Health provides the number and percentage of cases impacting healthcare workers. And on an aggregate level, ODY provides the race of individuals, hospitalizations, and deaths as they are reported to the department. ODH provides forecast modeling of predicted cases, and ODH provides cases and tests completed for residents and staff of state-owned facilities, such as youth service cases, and testing completed for residents of state-owned facilities, such as prisons, youth detention centers, psychiatric hospitals, and developmental centers. This is certainly more information than the Department of Public Health has ever put out before. But it is a work in progress, and we're going to continue to try to broaden that, not just with the Department of Health, but in every other agency in the state. At the same time, we are charged by law with weighing personal privacy rights, weighing personal privacy rights of the individual citizens here in Ohio. In Ohio, the law specifically sets apart protected health information in Revised Code Section 3701.17A2. Ohio law allows us to give aggregated data, and that is the type of information that I just talked about. We cannot release data under Ohio law. That's what it provides. That is so specific that the data or data combined with other public data can then lead to a person's identity. So we have to strike a careful balance. The Ohio Supreme Court has recognized that protected health information under the Ohio Revised Code is an exception to the public records law. They did this in a case called Cuyahoga County Board of Health versus Lipson O'Shea Legal Group. However, as I said before, we are balancing our obligation to protect privacy with our desire to be as transparent as the law allows us to do it. Now, last week, we published information about positive cases in long-term care facilities in Ohio, including nursing homes. We found that there was inconsistent information, inconsistent reporting, and causing inaccurate data. We took that down. I've asked the Department of Health to fix that. They are in the process of doing that. They've been making calls and doing the due diligence. So we took the inaccurate data down. It is being corrected. And we'll be posting updated data Wednesday at 2 p.m. Wednesday at 2 p.m. And that is when that data will be updated every week. Further, I have directed the Department of Health to collect more specific information regarding nursing homes. This data will include COVID-19 cases broken down in each nursing home category by residents and staff. So we will report in each nursing home the number of residents, if any, who have COVID-19. We'll do the same thing for the number of staff. And when we report that information, we will report what is new since the last report and what the cumulative numbers are. So the cumulative numbers are just that, cumulative numbers. If someone has left the nursing home, if someone has died, those numbers will remain accountable to that nursing home or listed by that particular nursing home. But then people will be able to see the new cases that have just arisen in that last reporting period. So we'll also break it down, as I said, by facility and by county. So we're going to do that by nursing home, and we're also going to do that by assisted living facility. Again, the number of staff, number of residents who are COVID-19. This will be reported every Wednesday, will be updated every Wednesday. In addition to this, while balancing transparency and individual privacy rights, we will report aggregate death data for nursing homes and assisted living facilities at the county level. We will do this at the county level. The reporting module will need to be modified to accurately collect this information. So I expect the reporting on deaths at long-term care facilities by county will not begin this week, but should begin next week.